we didn't have a process established for transferring of patients or receiving patients in transfer. So there was a lot of data that we couldn't capture. We actually lost a lot of patients to external facilities because we weren't measuring the leakage. And when we were implemented, we actually not only been able to keep the patients in our hospitals from transferring out, we've been able to transfer within our sister hospitals, and we've also been able to capture the amount of patients that are transferred from our urgent cares, total of 17 today. How many of those actually do get admitted to our hospitals as either inpatient or observation? So this is all data that we couldn't measure before. So it's been a great discovery, really. Well, before we didn't have that data, so it didn't exist. And now, through the use of Forefront, we're actually able to run reports on all the transfers that go through our system. And it's new information that we've been able to capture, and we realized how much business we were actually losing. And we were able to identify where the problems were in order to fix it, in order to create a tool to solve it or to bring specialties that we were lacking, and to be able to distribute the volume of patients then transfer evenly across our system. This is something that was very uneven before. We obviously were losing a lot of business and a lot of potential to do better to our customers, to the community, because we didn't capture this data in the past. Well, it's been huge actually, because they realize the information that we hold. We are the centralized department that has access to the entire system, and they understand the value that we have attained through the years. And one of the changes that I see today is I get requests for reports for specific transfer types, like from L&D at one facility. They want to know how many patients they receive from facility A. And this is something that they know we can provide for them. So we deliver for them. And this comes from managers to directors to the CEO, COO, CNN. They've been able to analyze data to modify things that don't work, or to improve on outcomes on specific things they want. And we tailor this by department and by entities. And so we've been able to establish system-wide processes when it comes to transfers. We've been able to create an inpatient to inpatient transfer process that's system-wide. Obviously in collaboration with all of our 6 hospitals, we've been able to, after many meetings and building relationships and trust, we've been able to accomplish this. We also have an emergency department to emergency department process that is system-wide. And we have an urgent care to ED process that is system-wide. In our most, newest and innovative process that is system-wide is the creation of the telestroke through the transfer center. So I think the sky is the limit. We're still in the process of creating system-wide approaches. They're more now we've been open for 5 years, so I think they're a little more at ease with our involvement in the movement of the patients. And they realize that we have the bird's eye view, and we can probably identify the best place for the patient where they can provide the services the patient needs. I believe we are at a point right now where it is becoming a system-wide change, which in the beginning was more tailored to each hospital individually. And now we're more centralizing our process. So, and they're accepting that. So I think our involvement and the nurses and the techs and the staff that we have, it's educated enough to build the relationship, build the trust with all the hospitals, and we're becoming one system. So I believe that the creation of the transfer center has everything to do with that, to bringing the team together, which we didn't have before.